Well, for the latest on the health crisis in northern Gaza, let's bring in Tarik Jasarevic, who's the spokesperson for the World Health Organization. Really good to have you back with us, Tarik. As Israel's siege of northern Gaza enters its 20th day now, the World Health Organization recently conducted a joint mission in that region despite the hostilities there. Tell us what the WHO found in terms of the health situation there.
Well, we have heard from your correspondent that the situation in north of Gaza is really desperate when it comes to access and to humanitarian aid. There is intense bombardments, there is a mass displacement, evacuation orders. We are trying on a daily basis to reach hospitals in North Gaza. However, it's really difficult to achieve that. In October, only 6 out of 21 planned missions to hospitals made it through numerous checkpoints, and we got basically permission to do so. Last one was a few days ago, where when our teams managed to get to Kamal Adwan Hospital, but were forced to spend the night there after lengthy delays and waiting time at the checkpoints. At the same time, we managed to get out some patients from Kamal Adwan to Al-Shifa Hospital, but we were not permitted to bring in blood, fuel and food and other things that hospitals need. Our teams are trying again today to reach hospitals and do what is needed. But again, the situation is so bad that you may have heard that we had to postpone the second round of polio vaccination in North Gaza, simply because there was no agreement to have a humanitarian pause in all of the areas in North Gaza. So basically, parents with children would not be able, for security reasons, to bring their children for vaccination. So that just shows how desperate the situation is, and it just shows that really, if there is no ceasefire, if there is no let down in hostilities, then everyone living in Gaza is facing huge health challenges, not only children, but people who are wounded, elderly, people with chronic diseases, pregnant women. And we just keep repeating our appeal that health has to be protected, that health workers should be protected, and that patients should feel safe to go to hospitals. Unfortunately, we don't see the end to it right now.
And Tarik, we know under the rules of war, they prohibit direct attacks against medical personnel and health facilities. But since October the 7th, we've seen Israel repeatedly attack medical personnel and facilities. So your mission in northern Gaza recently was to move patients in urgent need of care in the north to a hospital in central Gaza. But what about for the other Palestinians left behind? If indeed, as you say, medical supplies and other humanitarian relief supplies aren't being allowed into the north, what does this mean for the Palestinians who are trapped in the north?
Well, unfortunately, we will see more deaths and more suffering. That's as simple as that. Under humanitarian international law, health facilities, hospitals, ambulances, health centers should never be militarized, nor should ever be a target. We have recorded more than 500 attacks on healthcare since October last year. And as your correspondent has said, according to the Ministry of Health, more than 1,000 health workers have been killed in Gaza. And that's the loss that it's very difficult to replace, because these are trained health professionals who have been doing a job of saving lives of their community members. It's not that health workers can be replaced so easily. We have people coming from outside. There are a number of medical teams, foreign medical teams, trying to do their best to provide the medical care. But again, if we don't have a sustained access to health facilities, if health workers and if patients cannot feel safe to provide and receive medical care, then unfortunately no humanitarian action will be enough. The only solution really is a ceasefire, and we just repeat our call for that. We hope those who have a power to make those decisions will hear our appeals.
Okay, Tarik Jasarevic, we will have to leave it there. But thank you so much again for joining us, and the very best of luck with your work in Gaza.